Hi, everyone. Welcome back for lesson 2 on our course about generational trauma. So I realized a little oversight last time in that I did not verbally review with you the resources. Hopefully you found them anyway, but I did want to mention them for those who maybe haven't done a deep dive into the course. So the first one is a book that I mentioned in lesson 1, and that is a book called It Didn't Start With You: How Inherited Family Trauma Shapes Who We Are and How to End the Cycle by Mark Wolin. The other activity that was there for you was a journaling prompt. So I'll read that for you now. And for those of you who didn't get to take advantage of it before, maybe you pause this lesson and take some time to journal about your thoughts on this. Or, of course, you can always continue moving forward. So the journaling prompt was, how has learning this definition of trauma and of generational trauma that I presented in lesson 1, how has that affected your thinking about trauma? Are the definitions that I discussed different from what you previously thought? And what new ideas did this lesson bring up for you? So hopefully you already have journaled about that or spent some time thinking about that, and that will make you really ready to dive into lesson 2. So let's move forward with that. Let me go ahead and pull up my PowerPoint here so that you can see the main points behind me. There we go. All right. Skip on ahead. All right. So those are the lesson 1 resources that I just mentioned. And then here we go into lesson 2, recognizing the signs and symptoms of generational trauma. So last time we talked about what it is, and we'll review that briefly, and then we'll jump into how to recognize it. So our learning objectives for this time. In this lesson, we're going to delve into the signs and symptoms of generational trauma and explore how it manifests in individuals who have experienced childhood trauma. By developing an awareness of these signs, we can begin to recognize the impact of generational trauma on our lives and take steps towards healing and recovery. So our learning objectives are going to be understanding the concept of generational trauma and its connection to childhood trauma, identify common signs and symptoms of generational trauma in individuals who've experienced childhood trauma, recognize the ways in which generational trauma may manifest in emotional and psychological well-being, and explore behavioral patterns and coping mechanisms influenced by generational trauma. So a quick review of what we learned last time. Those are our objectives again. And then quick review of what we learned last time. So far, we've learned that trauma is the painful and disruptive internalization of a difficult experience. We've learned that generational trauma is referring to the transmission of psychological and emotional effects of trauma across multiple generations within a family or in a community. And there we have Dr. Mate's quote again: trauma isn't what happens to you, it's what happens inside of you. That's our key takeaway from lesson 1. We want to make sure everybody has a hold of that concept. So here we go with our signs and symptoms. There's so many ways that trauma effects can show up in a person's life that there's no way I'm going to cover them all here. But these are some of the big ones. And maybe by understanding these, that will let you recognize others as well. But we're going to hit the main categories right now. So I'm going to describe some of these, but there are likely a whole lot more that I will not get into today. So you have your emotional and psychological manifestations. So that might be anxiety, fear, persistent feelings of nervousness, hypervigilance, we call it. That's when you're just always on alert. Fearfulness, depression, low mood, persistent sadness, lack of motivation, feelings of hopelessness. And then you've got your post-traumatic stress symptoms, flashbacks, nightmares, intrusive thoughts related to the past traumatic experience, emotional dysregulation, which is difficulty managing and expressing emotions, heightened emotional sensitivity, which is kind of veering one way on the spectrum of responses, and then emotional numbness, people who veer the other way of just kind of shut down. I can't handle any of these emotions. I'm just going to go numb. And then we have behavioral patterns. So those are going to be things that you can observe in yourself or in your family members. A key one is substance abuse. That might be engaging in alcohol or drug misuse, or even using it moderately, but clearly as a coping mechanism. You know, there is a connection between wanting to have alcoholic beverages on a stressful day. It's a way of coping, and it's not always a big problem, but it's definitely something to keep your eye on as you're tuning in and observing these patterns. Self-destructive behaviors might be any kind of self-harm, anything that causes injury. You know, that could go all the way from cutting or burning oneself intentionally to even just making choices that lead to physical injury. Risky behaviors could be anything from like driving too fast, promiscuous sex, unprotected or unsafe activities of any kind, destructive relationships, even, you know, getting into relationships that have a high potential for harming the person. And then the third category of behavioral patterns we're looking at is relationship difficulties. So that could be just struggles establishing or maintaining healthy relationships, patterns of conflict or codependency, difficulty trusting, engaging in any kind of like pursue and pull away patterns. Also, perpetuating abusive patterns. So repeating the abuse that the person experienced. And of course, the person doing that isn't trying to hurt others the way they were hurt. It's just an unintentional repeating of behaviors that were modeled and experienced. So unintentionally repeating abusive or neglectful behaviors within one's own relationships, because there's a normalization of it. You know, just a random example, you know, a person might say, well, my parents didn't feed me every day. It's fine if I don't feed my kids every day. Obviously, to healthy individuals, not fine, but to someone who experienced neglect can seem normal. And then we have the other category of somatic symptoms and physical health consequences. So somatic symptoms refers to symptoms felt in the body. So even though they may be tied to emotional or mental health reasons, they are felt in the body. That is like the stomach ache you get when you're nervous, or, you know, chest pain when there's panic, or even just getting a headache when you feel overwhelmed. Those are examples, but of course, there's an infinite number of other ones. And physical health consequences, I think we know what some of those are, but we'll go into that in just a little bit more detail. So the first category, chronic physical health issues. Physical symptoms such as chronic pain, gastrointestinal problems, or autoimmune disorders. This is really just coming to the surface of research, and doctors are only really now beginning to understand the connection between trauma and autoimmune disorders. The research suggests that the vast majority, something like 85% of people with autoimmune disorders have experienced some type of trauma. And it's hard to know what the correlation is there because so many people have experienced some type of trauma, but it definitely seems significant, and more research is being done on that. Yeah, so here we go with the somatic symptoms again, which I kind of got ahead of myself. But they are experiencing physical symptoms without a clear identifiable medical cause. And common ones are headaches, fatigue, unexplained aches and pains. And then our last category involves increased vulnerability to illness. And this is one of the ways that we feel like, based on the research that's available right now, immune disorders are tied to trauma, and that is the trauma is in different ways that we don't yet understand, weakening the immune system. And so there is an increased risk of cardiovascular disease and other stress-related health conditions. I'm pausing just to look ahead to make sure that I don't get too far ahead of myself. Yeah. So just want to give you some more examples of ways that the behavioral aspect may show up that you might be able to recognize in yourself or family members. And the behavioral aspects are the ones we really have the most control over. Those are where we can really work to create change and break the cycle. As you've probably heard before, and you'll probably hear me say again, I have a Facebook group called Trauma Recovery for Cycle Breakers that you're welcome to join if you're interested. And here are some of those big issues that come up that we can recognize as being signs and symptoms of generational trauma. So one of them is repetitive behavior patterns. So one of the key signs of generational trauma is the recurrence of specific behavioral patterns across family members. So these patterns may manifest as self-destructive behaviors. For example, a family with a history of domestic violence may witness a cycle of abusive behavior repeating across generations. And recognizing these repetitive patterns can be a clear indication of generational trauma. Oftentimes it can get a little better, but still be repeating. So for instance, as a therapist, I hear all the time people will say, oh, well, my relationship can't be that bad because it's not like what my mom went through and my grandmother went through, because they witnessed that. They were, fully witnessing aggressive physical violence, seeing their mother being beat up or shoved around. And so then when they look at their own relationship, where maybe their partner just occasionally grabs them or screams in their face or insults them verbally or manipulates them mentally, they think, well, this is so much healthier than what I grew up with, that I just need to work with it. And they don't identify it as domestic violence because of that. Going back to that normalization piece. For every person, what you grew up with seems like normal until you get other information that lets you know that it's not healthy. Because normal and healthy are two very different things. So normal just means it happens often, and healthy is desirable, good for me, and something that we want. Whereas normal is just common. That's really all normal means. Normal is not something to shoot for. So let's move on to other things you might notice in family patterns. So unresolved grief and loss. Generational trauma often involves unresolved grief and loss that can be passed down through family lines. If family members frequently discuss or avoid discussing, again, with that spectrum of different ways people can respond to a situation, family may frequently discuss something painful. It may be talked about all the time and hyper normalized, or it could be entirely avoided and totally taboo. So if family members frequently discuss or avoid certain things, certain tragic events or losses, it may suggest the presence of generational trauma. Suppressing grief can manifest in individuals as a sense of emptiness, chronic sadness, or difficulties in forming healthy relationships. Understanding and addressing these unresolved emotions is essential to breaking the cycle of generational trauma. Other things you may notice are anxiety, depression, mood disorders. Those run in families quite strongly. Mental health disorders, including anxiety, depression, and mood disorders, can be prevalent among individuals affected by generational trauma. These conditions may arise due to ongoing stress, emotional turmoil, and dysregulation inherited from previous generations. If family members consistently exhibit symptoms of mental health disorders, it's important to consider the possibility of generational trauma. Seeking professional help and support can aid in managing these challenges effectively. This is one that people are now beginning to notice, but oftentimes people will come in and say, no, I don't think anyone in my family has ever experienced any type of mental health issue. And that tends to be more related to previous generations not talking about it or not having words for it or not expressing it. And sometimes when my clients go back and have a pointed conversation with family members, parents, grandparents, and ask things like, have you ever felt low motivation or sadness, or did you have difficulty after having your first baby, things like that, they can actually get information that yes, what I'm experiencing is something that was experienced before. It just either wasn't talked about, or previous generations didn't have words for it. They didn't know how to talk about it. They didn't feel it was okay to talk about. Disrupted family dynamics is another pattern to notice, and that may look like family dysfunction, conflict, strained relationships, certain patterns of interacting, communication breakdowns, trust issues, and a lack of emotional connection may be apparent within the family unit. Some individuals may adopt avoidant or aggressive behavior, while others may become overly dependent or compliant. Recognizing these disruptions in family dynamics can shed light on the underlying generational trauma that needs to be addressed. What are all these things that are playing out that you can see in front of you? Like, where did they start? What are they designed to cope with? So you may notice this when you get into a relationship. Well, my family is very emotive and explosive and quick to engage in conflict, and my partner's family, they avoid conflict altogether. They never talk about emotions. And once you start seeing these differences in different families, that can help you start to notice the patterns for what they are. Because again, if you grew up in it, it seems normal and you think every family's that way until you start to look at it and compare to either an healthy ideal that you'd like to get to, or just other people's families and what their family dysfunction looks like. And so as we're approaching the end here, another thing to look for is cultural and historical context. The cultural and historical context within a family exists and can provide valuable insights into the presence of generational trauma. So communities that have experienced collective trauma, such as genocide, war, or oppression, may be susceptible to generational trauma. Understanding the historical context and its impact on families' well-being can help illuminate the roots of generational trauma and guide appropriate support and interventions. Additional tips for recognizing signs and symptoms of generational trauma are: pay attention to your thoughts, feelings, and behaviors. Are you experiencing any of the signs and symptoms that I've talked about today? Talk to your family members about their experiences, if they're open to that. Have they ever talked about experiencing trauma? Or, maybe they don't use the word trauma, but difficult experiences. Maybe even asking, like, what were the hardest things that you went through as an adult or as a young parent or as a child? And those can help you get to some of that generational trauma. Consider your cultural and historical background. Have your family or community experienced any collective trauma that you're aware of? So a big one that we're all aware of is the pandemic. And that has had all kinds of effects that we barely have scratched the surface of what the effects of that will be ongoing and in just our recent 3-year past. So things like that can be really impactful. And if you're concerned that you may be experiencing generational trauma, please talk to your therapist or other mental health professional. They can help you understand your experiences and develop a plan for healing. An example of this collective trauma, besides the pandemic, we all are seeing that up close and personal, but another example that comes to mind is, and I will see if I can link this in the resources. There was a video put out by the BBC about this, is China's lost children. So we all are fully aware of the industrialization of China. That's where we're getting all of our manufactured products from these days. But when that happened, Chinese people moved from rural areas to the cities to work in those factories. And what I didn't know before watching this video is that they were required to leave their children behind, to leave their children with family members, grandparents. And so in that process, you have children and parents being ripped apart in, a way that's more or less traumatic, depending on the age of the child. So the younger the child is, the more traumatic that's going to be. And then how long it goes on, whether they're able to reunite or not, all of those things impact how traumatic that experience could be. So I will link that video in the resources. And just to wrap up today, recognizing the signs and symptoms of generational trauma is a crucial step towards understanding its impact on individuals. Gaining awareness of the manifestations in our lives, we can begin to break free from the cycle and embark on a journey of healing and resilience. Remember, you are not defined by the trauma you've experienced, and there is hope for a brighter future. Also, as always, I want to remind you that if any of this material feels at all disturbing or upsetting, please seek support from the people in your life or find a therapist near you if needed. You can also reach out to me if you're in Tennessee. If you're not sure if your symptoms are significant enough to warrant therapy, I'm going to link a questionnaire in this week's lesson resources, and it can help you quantify how often you're experiencing symptoms related to trauma. So the questionnaire will ask you about a stressful event, and that'll be the trauma that we've been talking about. Stressful event can equal trauma, because if it feels stressful, it could have left a trauma wound. While therapy can be helpful for anyone, those who score more than a 20 on this questionnaire, I would definitely recommend seek some professional help for managing those symptoms. And today I'm going to remember to show you the slide with the other additional resources. I've got all kinds of things here for you. So I've got a recommended reading, which is The Myth of Normal by Dr. Gabor Mate, that was our quote from earlier that I mentioned. And the book is called The Myth of Normal: Trauma, Illness, and Healing in a Toxic Culture. There's so many things about our culture that can potentially be traumatizing. And then we've got the link to the video, which I will put up in addition to these things, we've got the activity that I mentioned, the checklist to kind of see where your symptoms are. And then also the journaling prompt. So this week's journaling prompt, I'd like you to take a little bit of time to reflect on your personal experiences and identify any signs or symptoms of generational trauma that may be showing up in your life or the lives of your loved ones. And sometimes you'll notice it showing up in the life of a family member, and then you realize, oh, and I also do that. It's a little bit easier to spot these things in other people. So that could happen. But what do you notice? Which events from the past are connected to these signs and symptoms for you and your family? Well, I thank you so much for joining me for lesson 2 of our course about generational trauma. And I will see you next time. Bye.